Thank you. You're doing great, honey.
Mark Taylor is not as active as he used to be. For the father of three, avid cyclist and full-time physician's assistant, slowing down was not part of the plan.
I had this left foot numbness, almost like a restless foot syndrome. And that just never went away. And just after about 6 or 7 months, I wasn't sleeping well.
Mark says his pain started in 2016 and only got worse.
A month later, worst headache of my life. While we were driving up to New Hampshire, I had to get out of the car, threw up all over myself. The kids were scared. My wife was scared.
How long till you got any relief with either of these issues?
Probably a couple years.
A couple of years of trying to get a complete diagnosis, taking different combinations of medication, and eventually forced to step away from his career.
Very difficult on my wife, very difficult on my children.
Mark was eventually diagnosed with neuropathy, a chronic condition that causes weakness, numbness, and pain from nerve damage in the hands or feet. His debilitating headache would remain a mystery for years. And he's far from alone. A new study published in the Journal of the American Medical Association found more than 51% of people are living with chronic pain. The risk jumps 30% for those 50 and older, and many live with that condition for more than a year.
Pain creates more pain. You tense up, that pain worse. Pain also causes stress, and we know that stress worsens pain. So if we can move in and just break that pain cycle, you can get relief.
Dr. Ben Moore is an anesthesiologist and pain specialist at Tufts Medical Center. He says he's seen it all.
What's been the most common complaint?
Back pain is by far the most common thing that we get referred.
Dr. Moore says chronic pain can last anywhere from months to years, but there are things you can do to help manage the discomfort.
Make sure that any acute problem that's causing pain is well managed, diagnosed and treated. The second thing is for the patient to really engage in that process and be diligent about taking medication, doing exercises, whatever it is that's part of that management plan. And I guess the third thing would be to look after your own well-being. Eat well, gentle exercise, sleep.
Dr. Moore treated Mark Taylor for his severe headaches using injections to successfully relieve his symptoms, then connected him with another specialist for even more support. Mark says it's the first time he felt real progress.
And I can kind of do things around the pool for a little bit, which I couldn't even lift up the pool skimmer before.
Today, Mark isn't 100%, but he's better, learning to live differently, something he says he's taking in stride.
Try to enjoy what I'm doing, what I can do with my children. I'm working on what I can do with my wife. So I don't look too much into the future. I just look at today, this week, and maybe my next visit with Dr. Moore.
So how can you prevent chronic pain? Dr. Moore says when it comes to your back, strengthening is key. And he has this advice. If you're asking yourself, should I lift this? The answer is probably no. He cautions that for some people, chronic pain may never be fully gone, but managing it can go a long way. I'm Jessica Brown, WCVB News Center 5.